So a urinary tract infection is an infection that can potentially involve any part of your urinary system, which includes the kidneys, the uterus, the bladder, and the urethra. UTIs are due to bacteria and microorganisms that enter into your urinary system. However, rarely some are caused by fungi and viruses. Anyone can contract a UTI, but they are more common in women, with a rate of 8 to 1. So for every one man that has a UTI, there are generally 8 women that would have a UTI. So signs and symptoms can include an intense and continual need to urinate, a burning sensation once you begin urinating, urinating often with tiny amounts of urine, cloudy urine, blood in the urine, which will appear, your urine will appear either red, bright pink, or cola colored. Urine that has a very strong and pungent odor. And in women, there will be pelvic pain, particularly within the center of the pelvis, and rectal pain within men. Now, an upper tract UTI, which infects the kidneys, has a couple different symptoms, and it would be pain and tenderness within the upper back and sides, chills, fever, nausea, and vomiting. So once you have a UTI, the treatments can include antibiotics, topical hormone replacement, but this is only for postmenopausal women who have frequent and recurring UTIs, vaginal estrogen, which can come in either a cream form, a small tablet, or a flexible ring that is inserted into the vagina. And a risk of a UTI is that the bacteria can potentially enter the bloodstream, which causes sepsis, and sepsis is blood infection, which is very serious and can lead to death. Now, to prevent a UTI includes drinking plenty of fluids, so like water and juice, pretty much any kind of fluid that will flush out any bacteria that is in the urinary system. Urinating regularly and avoiding holding urine for long periods of time, because that will allow bacteria to grow if you hold your urine. If you're experiencing issues with incontinence, which includes urinating in your bed and your clothing, you need to speak to your doctor. And if you're also having issues with fully emptying your bladder. So if you speak to your doctor when these first 2 signs come on, then there's going to be a less likely chance of you contracting a UTI. And also preventing the spread of bacteria after you're going to the washroom by wiping from front to back, because you don't want to pull any bacteria from the anus towards your urinary system.